Welcome back. During the winter months, we're a bit cooped up inside and it drives us crazy. But what things to do and have fun. A lot of time we take it. But here, it can also lead to injury if we aren't careful. ProMedica orthopedic surgeon, sports medicine specialist, Dr. Justin Lay is here to go over some ways to hopefully prevent winter sports injuries so we don't have to keep knocking on his office door saying, fix me up, Justin.
Absolutely. So thanks for having me.
So what are activities probably in the winter time that are most susceptible to injury?
Sure. So in the wintertime, the things that we often see are going to be injuries related to skiing, snowboarding. We see occasionally sledding and ice skating injuries as well.
But of course, a lot of people, though, even just regular folks shoveling their driveway,
Sure.
a wrong move, or they're not warmed up properly, go out in the freezing cold, and they try to shovel 8 inches of snow with the shovel, and they hurt themselves.
Yeah, we see that a lot too. So people just shoveling the driveway, whether it's kind of poor body mechanics or sometimes slip and falls. We see injuries of all those kinds of all those things. So.
Pickleball, has that caused a spike in some injuries? A friend of mine used to be a big tennis player. He plays pickleball, but he says it's not you think that's what all the old people do, and young people are playing it now too.
Yeah.
But still, what kind of injuries do you get with pickleball?
So yeah, it's absolutely all ages are playing it. We see, honestly, every clinic that I have, I see probably at least one pickleball injury. And so in the older patients, we generally see things like just aggravations of some underlying arthritis. We see occasionally some meniscus tears, knee injuries, ankle sprains, occasionally a fall and a wrist fracture, and similar injuries also in the younger patients as well. So.
Doctor, let's start with if I have pain, how do I know if I should write it out or if I should go to a doctor immediately?
Sure. So it depends on kind of the nature of the injury. So obviously, if you have a traumatic injury, you want to seek urgent evaluation in an emergency department. For more of your minor sprains, strains, contusions, or pain that may have just come with shoveling the driveway, the best initial treatment would probably be to follow the RICE method, which is kind of the tried and true method that we've probably all heard of. RICE, R-I-C-E, stands for rest, ice, compression, and elevation. And so really it just means, so say it's your knee that hurts, you want to get off of it, rest it, elevate it, put some ice on it. Ice kind of helps decrease swelling and the acute inflammatory response that causes pain. And then sometimes compression. And when we say compression, I should mention light compression. You don't want to overly constrict a joint. But compression, elevation, icing, if there's no medical reason you cannot take anti-inflammatory medications, using ibuprofen, Motrin, Aleve, those types of medications as well can be very helpful.
At what point do you transition from the ice to using a warm pack?
So initially you want to use ice. Ice helps reduce swelling and inflammation. So you want to try ice right after an injury or if you feel something feels swollen. Heat can be more useful in the warming up period. So it helps more of our muscles to kind of get loose, kind of loosens up some of the tendons and ligaments and things to get you ready more for activity, and ice more after an injury or any kind of joint pain.
Talk a little bit about if I want to go out snowboarding, skiing, whatever, ways to prepare my body before I go out there, so I'm not, if you're in a little bit better shape to do something like that.
Yeah, so if it's something you enjoy, the best prevention certainly is starting well in advance of the skiing or snowboarding season. So an off-season program where you're focusing on cardiovascular conditioning, strength training, especially core and lower body strengthening, and also mobility can be very helpful. So, there's a number of health clubs or training programs you can get involved in that would help get you ready for the season, and that would be the best thing you can do really to prevent it.
What are some of the tools you have to diagnose injuries to find out exactly what it is, whether it's a serious injury or just a minor one?
Sure. So, really our evaluation starts with a history and physical exam. So it just in discussing with the patient, kind of learning what happened, kind of reviewing everything that led up to the injury and then what happened during it. And then examining the patient, just kind of seeing exactly where their pain is, checking for any obvious instability or issues within their joint. And then after that, we often will get some type of imaging. First step would often be an X-ray. And then if we feel it's warranted, advanced imaging like MRIs, ultrasounds, CT scans may be needed.
A real good benefit is if people do the rehab, to go to a session once or twice, learn what they need to be doing, and doing any kind of activity to work that sore joint, get it loosened up a little bit and fix it.
Yes, absolutely. So, prevention and then after an injury, dedication to the rehab program really can go a long way. And it's really, what we do in terms of surgery or the treatments we provide are really a small percentage. The key is sticking and adhering to the recovery and the rehab.
If you'd like to know more about the ProMedica Physicians Orthopedic Surgery and Sports Medicine office. There's the location there in Perrysburg, and there's the phone number if you'd like to call them. So call these outstanding doctors like Justin Lay right here, and he'll get you fixed up if you do too much here this winter. Have a safe athletic winter anyway. Justin, thanks so much for being here today.
Sure, thanks for having me.